Good afternoon. Welcome, everyone. So this is the weekly webinar for school children organized by Kappa HC, Chinese American Parent Association of Howard County. And this event is sponsored by COED, Howard County Community Organizations Active in Disaster. I'm Dr. Yun Lu, and I'm organizing this event on behalf of Kappa HC. This is the second seminar. So last week, we talked about coronavirus. And today, I'm going to talk about pandemics. So if you have any questions, you can type in the chat so you can see, and you can type in some chat to everyone. So I already mute everybody, so I couldn't hear you. And also, after we finish, you ask questions, you can unmute yourself. The talk is about 40 minutes, so we will finish around 3:40. I think most of you have heard about the term pandemics very frequently nowadays, right? So the school has been closed because of the COVID-19 pandemic. So this is a screenshot I took from the Johns Hopkins website. They show the COVID-19 case in the United States. So here is the map of the United States. You have heard about the term coronavirus and COVID-19. What is the difference? COVID-19 actually is the disease. The official name is coronavirus disease 2019. And the virus that causes this disease is one type of the coronavirus. And it has an official name. It's called SARS-CoV-2. Yeah. So SARS-CoV-2 is the name of the virus, and the disease is called COVID-19. This map shows the number of confirmed cases in different locations, and you can see here we live around this area, and along eastern coast we have pretty high number of cases, especially in the New York State. We also see many cases in California and also in Washington State. Right. And this is a very similar map, but the disease is different. It's the weekly influenza surveillance on CDC website. So you may ask, well, the maps are so similar, right? But do we call influenza pandemic? What's the difference? Many of you may have heard about pandemic, and you know that, well, it's not only in one country, it got widespread to many countries or continents. So here is the North America, South America, European countries, Africa, Asian countries, Australia, New Zealand. It's pretty much widespread. And you can see, as of yesterday, the total confirmed COVID-19 cases is more than 2 million people. And the total deaths is 0.16 million. That's a very large number. But how about influenza? It also happened around the world. Because you can see each year we have many influenza cases in the United States and also around the world. But how many influenza pandemic do we have? Each year at school, many of you receive influenza vaccines. So we have seasonal influenza every year, but do we have influenza pandemics every year? Well, the answer is no. For the past 100 years, there are 4 influenza pandemics. And we already know that it happened every year, and also it happens all across the world. But why not every year we have influenza pandemic? And what is the difference? So I want you to take a closer look at these slides. So first, in the title, it says influenza A viruses since 1918. So you see influenza A. Does it mean that there are also other types of influenza viruses? And we also see 1918 pandemic, H1N1, 1957 pandemic, H2N2. So what do I mean? Why we have H and N, and after that have different numbers? And many of you may remember the 2009 pandemic. That happens in the fall, around September to October. That is the most recent pandemic. And you can see the color of this 2009 pandemic is kind of similar to 1918 pandemic. Are they similar? Okay. Let's keep those questions in mind and learn more about pandemics and viruses. Here is a influenza virus structure. So you can see on the surface of the virus, they have different types of proteins. The blue one is called hemagglutinin. If you look at the first letter, the initial, it's H. We also have a purple one. So that is called neuraminidase. And the letter starts with N. So if you recall the slide before, we have H1N1, H2N2, H3N2. Actually, H is this type of protein, hemagglutinin, and N is neuraminidase. So basically, there are different types of influenza viruses. And for the influenza A viruses, it can cause seasonal epidemics and pandemics. Okay? And then we divide it into different subtypes based on two proteins on the surface of the virus. That is H and N. So there are 18 HA subtypes and 11 NA subtypes. So if you do the multiplication, what is the number you can get? How many possible combinations are there? You can type it in the chat if you get the answer. What is 18 multiplied by 11? It's 198. But do we have all the possible ones? Well, actually, no, there are only 131 subtypes have been detected in nature. So we don't have all the possible combinations, but we have 131 subtypes. We also have the influenza B viruses. They cause seasonal epidemics, but they typically do not cause pandemics. And we classify them into two lineages. We don't call them H or N. They have two different names. One is B Yamagata, the other one is B Victoria. So you receive influenza vaccines every year, but do you know what type of the antigens are there in the vaccine? Actually, if you receive the trivalent influenza vaccines, it contains H1N1 subtype A and H3N2 subtype A. And also have B Victoria. There are also quadrivalent vaccines. So in addition to those three I mentioned above, it also contains B Yamagata. There's also influenza C viruses, but they cause very mild illnesses and they don't cause human epidemics. That's why you don't really see it in the vaccine and you don't hear it very often. There's also influenza D viruses, but they primarily affect cattle and they don't really cause human illness. So now you can see there are 4 types of influenza viruses, and influenza type A virus is the only one that can cause pandemics. And A and B, they can cause seasonal epidemics. So the seasonal epidemics, they come back every year and it affects people, but not at a global scale. Okay. So now let's go back to the slide that we have seen before. Now you can see why for these pandemics, we only have the influenza A viruses since 1918, because that is the only type of influenza vaccine that can cause pandemics. Okay. And now you can also see about the age and end their numbers after that. So we have 1880s and 11Ns. But now you can see, well, I've seen 3 H1N1. So out of the 4 pandemics, 2 are H1N1. One is H2N2. The other one is H3N2. So we don't really see any other combinations. And we also see that the H1N1, it just stopped after 1957. But H3N2 was still existing up to today. And the same for the 2009 H1N1 pandemic. And so for the influenza vaccine I mentioned to you earlier, they contain the H1N1 subtype A and also the H3N2. But we don't really include those H2N2 because you can see it just stopped after 1968. So last week, when we talk about the coronaviruses, we show this picture. So you can see the structure of the virus, coronavirus, looks a little bit different from the influenza virus. Coronavirus is also a large group of viruses, and they're named by the crown-like speck on their surface because corona means crown in Latin. They also have several coronaviruses and cause very severe disease, and this year we have the SARS-CoV-2. It caused the disease, the COVID-19. You may heard the term novel virus because that is a new strain. It's new and it hadn't been previously identified in humans. Well, because each year we have the influenza, seasonal flu. So I want to see what's the differences between the seasonal flu versus the pandemic flu. So let's first look at the definition. So the seasonal flu can caused by flu type A and type B viruses. So that's what we learned previously. And it can occur among people worldwide. But how about pandemic? So first, it has to be new. Also, it's a flu A virus, not flu B. That is also need to be very different from current and recently circulating seasonal flu A viruses. So actually the 2009 H1N1 flu virus kind of similar to the 1918 flu A virus, but they are so many years apart. So you still consider 2009 as new flu A virus, and it's different from the current and the recently circulating seasonal flu A viruses. And the people have found that for the 2009, actually, the older people, they're less affected by the H1N1. So it's probably because some of them already have antibodies against this H1N1. And how often do the seasonal flu epidemic occur? Comes every year. But how about the pandemic? And we know that in the past 100 years, there are only 4 times. So last week, I also showed this picture. So there's a term, spillover. That is the transmission of the pathogen from an animal to human. Because when we're talking about novel virus, it has to be new in humans. But for SARS-CoV, which caused the 2004 SARS disease, it's originated in bats and transmitted to humans by civet. And for MERS, transmitted from camels to humans. Ebola, bats to humans. For 2019 H1N1 from pigs to humans. So that's why it's also, it's 2009. And there's a typo here. So that's why we call it swine flu. And for the SARS-CoV-2, it's a new virus. New information still coming in, so still need to be determined. We don't know for sure at this time. Okay. How do the seasonal flu virus spread? Spread from people to people through droplets. And you can see there's also about 16 feet. So we have heard that during the COVID-19 pandemic, we need to keep social distancing. So you want to stay 6 feet apart because you want to reduce the transmission of disease from person to person by droplet. How about the pandemic flu? Actually, it's the same way as the seasonal flu. But there's a difference. As you can see, the pandemic virus is new. So that's why few people will have immunity, have the antibody against it. So that's why they will likely infect more people. And there are other highly contagious diseases such as measles. It can rapidly transmit to people, but because of the availability of vaccines, so you don't really see that many of measles disease and infections. Is there a vaccine for seasonal flu? Yes. The answer is yes, and most of you received vaccinations every year. And how about the pandemic? Well, the pandemic flu is caused by new virus. The US government will have a limited stockpile of some pre-pandemic flu vaccine, but because during pandemics, disease spread very quickly, so vaccines may not be widely available. And sometimes the 2 doses flu vaccines will likely to be needed because there are few people already have immunity, and we want to make sure that we effectively develop antibodies against this new virus. But now let's think about the COVID-19. Is there any similarities between the pandemic flu and the COVID-19? For this COVID-19, it's also caused by a new virus. So very few people have immunity to the pandemic flu virus. And right now, we don't really have approved vaccines. So there are many similarities between pandemic diseases. Are there medications to treat seasonal flu? The answer is yes. There are antiviral treatments that can treat seasonal flu, as far as you go to see the doctor quickly enough. So it needs to be administered at the early onset of the disease. So you don't want to wait several days to see the doctor. But how about the pandemic flu? Because it's a new virus, so we don't really know whether the existing antiviral treatment can treat the pandemic flu. But if the virus itself is susceptible to the drugs, then we can use it. But during pandemic, because so many people got sick, so sometimes it's difficult to supply those treatments. But how about COVID-19? This is a new disease. Right now, we have no existing approved drugs to treat COVID-19. But you may have heard about some drugs that have been used, but those are authorized under the emergency use authorization. So they are not approved to treat COVID-19. There are existing drugs approved for treating other type of conditions. For example, malaria caused by mosquito bites. because they're already on the market, so we know that those treatments are safe. So we hope that during this pandemic, they can provide some help to those patients. That's why right now they can be used under the emergency use authorization, but they are not approved yet because we need to go through clinical trials to make sure that they are safe and effective. The next question is, who is at risk for complications from seasonal flu? So you can see there are many people that may at higher risk of the seasonal flu. Very young children and elderly people who are 65 years older, and pregnant women, and also people with some other type of long-term chronic diseases. So that's why you can see we recommend people taking this influenza vaccination, and for people 65 years or older, because their immune response may not be as good as the younger people. That's why we also administer high-dose influenza vaccines that contains 4 times the amount of antigen compared to the regular influenza vaccines. So we want to make sure that they are safe and want to prevent them from having the disease, or at least reducing the risk of having the disease. But how about the pandemic flu? Well, again, this is new. So we don't really know who is at most risk. So as I mentioned before, in 2009, it's the H1N1 pandemic. And people have found out that actually for elderly people, people who are 65 and older, they actually have higher risk. Typically, they're at higher risk, but during that 2009 H1N1 pandemic, they're at a lower risk because some of them already have antibodies. And for this COVID-19, again, this is new. So we want to make sure that we understand this new virus and the new vaccine. So we keep collecting information. So right now there are many new studies going on. And it's very important that we collect accurate and up-to-date information. So this is a slide from the 1918 influenza pandemic. So during those time period, people don't really travel that much. But during that particular time, there was a war, World War I. So you will see that there are armies, they moved from places, and they also moved from different continents. So that's why you will see that this 1918 pandemic flu spread all over the world. And some of them call it Spanish flu. But do you know whether it's originated in Spain or not? Anyone know the answer? If you know, you can type in the chat. Actually, the Spanish flu was not originated in Spain. So there are some evidence showing that, well, probably it's originated in the US. But however, it's during the war. And at the war, many of them, lots of countries fight the war, and they don't want to say this. They don't want to report it. And Spain was not involved in the war. So basically, they first talk about this flu and report the cases. So that's why people gave the name Spanish flu, even though it was not originated in Spain, but they are the first one who talked about this flu. Okay. And when we look at 1918 influenza pandemic, you can see there are 3 pandemic waves. So the first wave has a smaller peak. And then in the fall, they have a much higher peak and cause more fatalities. And the next year, there's a third peak. So during this COVID-19 pandemic, we also need to be very careful. So because this is a new virus, this is a new disease. So we don't really know whether we have one way or multiple ways. So that's why we really need to learn more about the virus and the disease and practice social distancing. So during the 1918 flu pandemic, there are estimated 50 million deaths globally. The number of deaths is 5 times the military losses of the World War I. So we hope that we will learn from the 1918 flu pandemic, and we can prepare better for this COVID-19 pandemic. It was a talk at the CDC 2 years ago, talking about 100 years since 1918. Are we ready for the next pandemic? So they're talking about that, well, we know that we're going to have another pandemic, but the question is when. So we need to be ready. For this COVID-19 pandemic, it's a very rapidly evolving process because it's so new.
I'm not sure I understand.
It's really new, and we have keep receiving new information. And additional information will help us understand this disease and the virus better. And the people also work together as a team to fight this pandemic. So on January 31st, the Health and Human Services Secretary declared a public health emergency in response to this COVID-19 outbreak. Because it's so new, at first we didn't even have test kit. If we don't test, how can we know whether people got infected or not? So scientists, they identified the viral structure. And people developed new test kits very quickly. And there's no existing FDA-approved drugs and vaccine for COVID-19 because it's so new. But then the emergency use authorization allows the healthcare providers to use the test kit to diagnose the disease and also use drugs to treat patients. And there are also hundreds of ongoing COVID-19 related clinical trials to investigate vaccines and the drugs. So we hope that we'll be able to develop a vaccine that can prevent COVID-19. We're hoping that we'll get a treatment that is effective in treating COVID-19. And for us, we need to practice social distancing, make sure that we reduce the risk of transmitting the disease. I know that many of you have been doing a great job. Stay at home, practicing social distancing. And we also need to help others because at this time, we know that there are healthcare providers. They have to go out to work. They are essential workers. They are also elderly who may be at higher risk of developing this disease. So the community come out together and help each other. People donate money to provide protections for the healthcare providers and provide meals and help local restaurants. And also ask let elderly to go shopping first or help them deliver groceries. And for the school children, I think you guys did a great job because you don't do party or you don't or play date or sleep over. But maybe you can make some cards for the healthcare providers and elderly and show your appreciation and love to the community. So this is a very difficult time. I know that most of you may feel bored at home, but you want to keep connect with your friends virtually. So let's all do our part, work as a team to fight this COVID-19 pandemic and practice social distancing. So that is a slide I showed last week when I talked about coronavirus. So that is a basic reproduction number, Arnold. It describes how many cases of disease an infected person will cause. So you can see for Ebola, it's roughly 2. So 1 person goes, 2 people got infected. And then the next round, 4. So that's powers of 2. And for SARS, it's roughly 4. So 1 person infect 4 people. And then the next round, 4, you take to square is 16. But how about COVID-19? Roughly 5.7. So if you think it's 6, so 6 squared is 36. It's much faster compared with Ebola and the SARS. And for the measles, you can see it's 12 to 18. So 12 squared is 144. But for measles, because there's vaccine available, so that's why you don't see that many of measles cases. So that's why it's very important for us to practice social distancing, because this COVID-19 transmits very quickly, and this time we don't have a vaccine available and no treatment available. So make sure stay 6 feet from each other, don't gather in groups, and you guys did a really great job to avoid crowded places, and let's do social virtual gathering. And next week, actually, we are going to have talks about magic shows. Okay, and then the week after, we'll have people talking about capital market, about crashes and recovery. So I hope that you take this time, spend time with your family, connect with your friends virtually, and help our community. Well, okay, so that's what I got last week, but these, you can see today, the number changed quickly. So Maryland, we already have more than 10,000 cases. That's why it's very important for us to keep social distancing and do our part of the job. Okay. So here I provided some resources for COVID-19. If you like, you can check all the links and follow the CDC, Maryland, and also Howard County website for the daily update. So right now, I think I can unmute someone. If you want to ask questions, you can unmute yourself if you want, since I already finished talking. And then the remaining meeting time is about 3 minutes. Okay, sure, yeah. Okay, yes, I have one question about the slides. Yes, I'm going to publish the slides, yeah. Any other questions? If you want, you can unmute yourself and ask question. Yeah, we have about 3 minutes, so feel free to ask questions. Any question related to COVID-19 or pandemics? Thank you, everyone. So hope we'll send out a flyer for next week. Next week there will be a magic show. So I hope that you guys will enjoy the magic show. Thank you, everyone.